Perfect. Hello. Being recorded. Okay. Let's get my screen shared here. Welcome, everybody. I'm so happy to be here. I love doing these with you guys. It's always like so much information crammed into 15 minutes, which is super fun for me to try and do. So I will do my very best to honor your time. Time is our non-renewable resource, so I always want to honor that resource. So we will kind of get rolling here. So we're going to talk a little bit about animal-assisted therapy today. I'm Dr. Teresa Rogers. I own the Relationship Center. We have 2 locations in Northeast Ohio. I also work with In Step with Horses. They're an equine nonprofit for equine-assisted therapy, which is super cool. So if you were ever interested in equine-assisted therapy for yourself or others, In Step with Horses is in Chesterland, and they do an awesome job. That is Violet, the therapy cat that lasted until he was a teenager and then decided he didn't want to be a therapy cat anymore. So our goals for today, we're just going to look over what the difference between the different types of animal-assisted activities are, look at some applications and interventions, and just some things for you to consider moving forward. So that little guy right there, that is Violet when we found Violet in a bush. And then he became our office cat that all of our clients helped take care of because he was so tiny and needed all of the love. He'll show up throughout our thing here today. Okay, so there's 3 different kind of types of areas of animal-assisted therapy interventions. The first one is animal-assisted intervention. So this kind of is the big umbrella of everything. Any kind of use of animals to benefit humans kind of falls under animal-assisted interventions. So there's a handler, it's partnering with a therapy animal in some sort of way. We're working as a team in order to assist other people. It may directly involve the animal. It may not directly involve an animal. We may be just talking about animals or imagining or whatever, but it's kind of that animal-assisted intervention. However, service animals don't fall under this because they are individually trained to perform a work task for people with disabilities. So service animals are their own thing. So we're putting them off to the side, not talking about service animals, just kind of all this animal-assisted activities and interventions. Animal-assisted activities are kind of the next step down from that broad umbrella. So these provide opportunities for education, therapeutic, recreational benefits to enhance life. Usually you'll see this in volunteer spaces, like the meet and greets at the hospital or long-term care centers. There is not a specific treatment goal for any of the animal-assisted activities, and it's repeatable. So the same dog could go to the library every single Saturday and read with 7 different kids. And so that would be an animal-assisted activity because it's just applied the same activity over and over and over again. It's not super specific to that specific client or person. So an example of this is we went to my son's school and we made feral cat boxes for them. We brought kind of all the supplies. And so that wasn't even directly working with an animal, but we were working for animals and to support animals and talking about animals and giving back to the community. So like that would also fall under kind of animal-assisted intervention, animal-assisted activity. So it doesn't necessarily have to have an animal. So that's something really important to keep in mind because we don't all have animals. Some of us have animals and then they don't want to be therapy animals anymore. And so there are many other ways to incorporate the power of animals into our sessions if we don't actually have a little critter that wants to hang out with us. And then we have animal-assisted therapy. So this is therapy. This is structured. It is goal-directed. It is delivered by somebody with a license. The purpose is to improve human physical, social, emotional, cognitive functioning. There is a treatment plan that this animal is a part of. It is documented and evaluated. Sessions have a fixed length. this animal is doing a different thing for different people based off of their treatment plan. So animal assisted therapy, we went down the funnel, is kind of that bottom of that funnel and is very specific and has a more therapeutic identified purpose. So there's Violet in his window seat, as he would like to sit, is his attack cat. So the research, finally, we're getting all kinds of good research coming in. Way back when, we didn't have much good information of what animal-assisted therapy did, but now we've got some good stuff. So we have outcomes showing increase in self-efficacy, improved self-esteem, anxiety, depression scales are lowering. You can see social, relational skills building, just overall quality life improve. You're definitely going to see some of like the brain chemistry increasing. So like that relaxation response, releasing different hormones so that mood is elevated. We're seeing lots of improvement in communication and socialization and empathy and understanding others. So lots of good research out there. All of that is, you could Google it and it will pop up there for you. A key thing that I want you to keep in mind is this is a partnership. We want to call this a partnership, and there is a power dynamic. So you are the one in control here. So we want to be working together, right? That is our goal, but like you're the one that makes the final call. And so you need to be very intentional and aware of your animal, of your client, of the setting, of all of the things going on. It's a live environment. And so it is a partnership, but there is a power dynamic. And that lies on you, in my opinion, to care for the animal first, right? We can take care of our clients without an animal present. We can help them meet their goals without an animal present. Forcing an animal to be a part of this, if they are not consenting to this or there's not a good fit for service, then that is now doing harm to the animal, and that is your responsibility to ensure that you are not harming this animal. And so that comes with knowing your connection with your animal, being able to speak your animal and know what their cues are. So when Violet didn't want to come to the office anymore, he wouldn't get in his cage when it was time to come. He would walk around and hiss from time to time at clients. So like there are cues of like, okay, you don't want to be a therapy animal anymore, and that is okay. And that was my responsibility to care for him first before my client, to make sure that he is safe and healthy and okay, because my client, I can care for without Violet there. Yes, it makes everything better, I think, but the client can meet their treatment goals without the animal. So these are just some things that are really, really, really important for you to consider if you do have a therapy animal, if you're thinking about getting a therapy animal. That's Sunny. She was going to be one of my therapy dogs, and she was not good at it. She would sit behind me, behind my chair, and like low growl at the angry man in the couple who was like getting wound up in session, as happens in session, right? That's normal. Like there is going to be a variance in like intensity, and she could not tolerate that. So she would sit behind me and kind of like low growl at the guy. And it was like, okay, and this is not your space, right? This is causing you stress. So now Sunny is one of our 4 dogs that are all failed therapy animals because none of them wanted to do that. So something I think that is so, so important to consider. If you want your dog to be a therapy dog, here are the steps to go about doing that. And you can kind of, again, Google this. All of this information will come up for you. So with your animal as a co-therapist, again, we're seeing this helps clients feel safer, helps clients feel more grounded. The opportunity for physical touch is huge, and it's something that we from human to human can't really offer our clients because of our boundaries, but like animals are able to break that boundary. And that's what's so cool about this, is that the clients get this opportunity for that physical touch. It also really helps build rapport. Like, we have this connection with this animal and cool, like clients feel a lot more plugged in and engaged with you because we've got this little creature roaming around that is restabilizing the environment. Animals create unconditional and non-judgmental space and affection for the clients. Violet right there is not judging you, right? Like, you can be you. Violet's here for it. She's happy to be a part of this. You know, Sunny, well, maybe not with that guy, but with somebody else, Sunny's willing to engage and like wag her tail. And no matter what you're saying, we're judging ourselves, right? But these animals, they're not judging us. And so that's an amazing like piece that animals offer. We're also able to really practice communication because we can't speak to them. They can't speak to us, but they are talking to us and they are showing us language. So like we can learn that communication piece. And it also teaches us about our client's emotional state. Like, what's going on with this client? How are they interacting with Sunny today? Like, are they like, oh, hi, Sunny, right? Like, is that, or are they shut down? Are they withdrawn? Are they angry? Like, you get a lot of good cues just based off of how they greet that animal initially as to where they're at that day and how that changes over the time of the session. So those are good reflection back points. You don't have to have a live animal, I promise you. The research supports virtual animals, looking out the window at animals. All of this can lower heart rate, lower blood pressure, still have the same outcomes as having that physical animal there. So like, this is the window in our North Canton office. We always have deer coming by. And so we sit there and watch the deer, right? I could be in the middle of session with somebody. I don't have an animal in my room. And here come the deer. And we literally stop the session to watch the deer. And then we talk about the deer and notice what's happening in our body. Because like, really, you could be real amped up telling your story about whatever's going on. Here come the deer and we're just watching them. And like, I can witness and see the client's kind of nervous system, like slow down, re-regulate out. So I always like to point that out, what just happened there for you. So no need to have an animal in your room because we may have animals outside. You can also use pictures of animals. Like, I will tell people, get out your phone, show me the cutest picture of your cat. I want to see your cat today. Virtually with clients, right? Like, everybody's got their animals roaming around. I want to see them. So I ask them like, hey, go get Jupiter over here. I need to see her today. That changes the dynamic, right? That calms them down. That engages them in this different way. Imagination of animals. We don't need to have any animals in any sort of way. Like, go outside and look at the clouds, provided it's not just like super cloudy like it's been, but like the big white puffy clouds, right? Like, what do those look like? What are you seeing? Is that a dragon? Tell me about that dragon. What's happening with that dragon up there? So there's so many ways to integrate animals without actually having to have an animal there. So don't let not having or having your failed therapy dogs, like, you don't need it. There are many other ways to utilize. These are our fox friends. They're also at our North Canton office. That brings lots of really cool interaction with people. Even just the meaning of a fox. I had a client, she had just gotten a fox tattoo randomly, and then the fox was there the next time, and she intersected that and connected that because the fox was a thing for her grandma, this tattoo, and then this fox showed up, and that had that amazing meaning. So like, you never know what these little connections are going to show up about stuff that you didn't know about your clients initially. And you don't have to have this wonderful wilderness behind your office. This is the parking lot at our Mayfield office. And there's a mama killdeer right there. She's laying her eggs and sitting on her nest right in the rocks in the middle of the parking lot. And that's Mr. Killdeer there. And he guards her and walks around the parking lot guarding her. So we don't need to have some big lush forest with deer and foxes and groundhogs, right? Like, right in the rocks in the middle of the parking lot. Here's a story. Here's a narrative. Ask your client to tell them about it. They get connected with them. I got little kiddos that are like, oh my God, where's the killdeer? And they go and like look out the window. So like, we don't need to have some amazing like tropical forest. Looking at the application, there's so many applications that animals have on humans. So we have that attachment piece, the bonding, nervous system activation, watching fish swim or listening to a horse chew slows your breathing, slows your heart rate. Pull up YouTube video of fish swimming around, right? Heightened blood pressure. If you touch, hug, any kind of interaction with that animal, that physical touch is going to lower the blood pressure. Our social skills, read to the animal, talk to the animal, share with the animal. Those are all ways to kind of build that social skills up and learn about body language, learn about interpersonal dynamics. The mood and neurotransmitter piece is huge. So sharing space with an animal is going to increase your serotonin, increase your oxytocin, and your dopamine. So all of that right there, instant mood booster. Even if it's funny cat videos on TikTok, like that even will lighten that. That will increase like the laughing and the joy, which is the oxytocin and the serotonin. Animals also offer that responsibility and routine. If you have a client with some executive functioning challenges with sequencing or task management, hello animals, we have routine that you need to eat. Also with a client with some depression, right? You got to get out of bed because we need to take care of this animal. We need to feed them. We need to make sure that they are okay. So like that is getting me moving. If I'm feeding my animal, that means I'm going to eat as well. So there's me nourishing my body. So many connections can be made with that responsibility and routine that comes with animals. This is Kasari. So we were doing Kasari's stretches because she needs to stretch every day because she's got some tight legs, right? So there is us taking care of her body, giving us that feedback of like, I should be taking care of my body and doing my stretches and how important movement is to me. Standing alone with a horse, just gazing out there, right? That biofeedback is so important. So these are at InStep with horses. These pictures were taken. And then looking at some interventions, so ways to kind of go about integrating animals. So that projection and storytelling. Look at the clouds, see that dragon, tell me what that dragon's doing. Whatever that client's going to tell you is going to give you a peek into their life or into their perception or the way that they are understanding their world. Amazing information there. Boundaries, we're setting boundaries and we're getting permission. Does the dog want you to approach it? How do we know that dog wants you to approach it? Is it giving you permission or is it giving you cues not to? Also rolls into that communication piece. How can I ask this animal to sit or stay? How can I teach it that? What is my tone? How assertive am I? How passive do I need to be? If you're trying to move a horse, right? Like if you're going to yell at that horse is not going to move. You need to find a way to communicate with that horse in a way that it's going to partner up with you and that typically isn't coming super aggressive or like wily at the horse. So great communication information, tools, and learning there. Mindfulness, just breathe next to an animal, right? Biofeedback. So if you are within 6 feet of a horse, their heart rate is lower than our human heart rate. Because their heart rate is lower than ours, if you're within 6 feet of it, your heart rate is going to reduce because of biofeedback, which is so freaking cool. I love that. You can see relationship and family dynamics. So if you assign this task to them, who takes the lead in the family? Who are the followers in the family? Like, all right, you're going to feed the dog today. Like, what are our ideas about how we're going to feed the dog today? You're going to see some of those family dynamics coming out. And then we've got some good DBT stuff going on about the emotional regulation and the distress tolerance. I would say when you are interacting with a client and an animal in any way, similar to play therapy, let the client lead. Let them name it. What do you think what do you think Sunny's thinking right now? What do you think that look on her face means? Like, what do you think about this? Let them lead. Let them tell you. That's going to give you the best insight as to where they are at and the way they are perceiving things. If you are in an in-home setting, pets are not therapy animals, but they are handy, right? So building that relationship, if there's a hamster in your client's home, okay, great. First, we need consent from the animal and consent from the adult who owns the hamster, right? But also, like, we could talk about, like, oh, what does Jerry need? Did you take care of Jerry today? Did you get him water? Did he run on his wheel? What do we need to do with our wheel? You know what I mean? Like, we can integrate pets into some animal-assisted therapy techniques that are very, very helpful. But again, just kind of making sure you have a relationship with that animal in some way, shape, or form, and that whoever owns the animal is also consenting. And then the final considerations, all of the things we don't have time because we have 15 minutes, right? Here's all of the stuff that you have to, I would say, get more training on, more understanding in. There's liability insurance stuff, there's agency policies, there's allergies, there's injuries. There is fear of animals. You can't just have a dog roaming around your agency because some clients may have a very big phobia of that. That needs to be considered, even if your client is okay with that. What does the physical space look like? And then a piece is also the grief piece of, like, what happens if that animal passes away, which is really, really hard. So that's Lily. She passed away, and that was hard for all of our clients. So something to consider of how we're going to address grief. So that's our future considerations. And I know I landed this plane with like a minute left. You feel free to email me if you ever have any questions. I love talking about animal-assisted therapy and helping people through this. And that's Sunny and that's Violet when he was a tiny, tiny little baby, and they were the best of friends. So plane has landed. Thank you so much for having me here. I really, really, really appreciate it.